being Heart Month, we thought we'd take a minute and answer a few questions about blood pressure. What is blood pressure? What do those top and bottom numbers mean? And when or why you should be concerned about your blood pressure? And maybe even consider taking it at home and being proactive in your healthcare. My name's Heather Missler. I'm a nurse practitioner here at Firelands. We see high blood pressure day in and day out. It's very common. The scary thing about high blood pressure is there aren't any symptoms. And I think often patients underestimate the damage that can be done when left untreated. The fact is, when left untreated, the blood vessels take a hit and develop damage over time. This damage leads to complications, especially with those small vessels. You can have some vision loss, you can have kidney failure, ED, and of course the stroke and heart failure. The top and bottom numbers. The top number is what we call systolic. Systolic number is the pressure within the heart and the vessels when your heart is actually pumping. The bottom number we also call diastolic, and this is the number when your heart is at that resting phase for that split second. Whether or not you have hypertension, it might be a good idea to check outside the office. Monitoring outside can give you a better, more accurate measurements over time versus that one measurement in the office. And especially if you're one of those patients that feel that your blood pressure is just elevated when you come into the office, really good idea, get some measurements at home and support your argument when you see your provider next. Few key points when considering a home blood pressure cuff. One, unfortunately, insurance doesn't always cover these types of devices, but they are an FSA and HSA eligible item. You can usually get them either online or your local pharmacy for about $20 to $40. As far as the cuff itself, upper arm cuff is going to give you a much more accurate measurement just because it's closer to the heart. The size of the cuff is also important. When you're going into the pharmacy to look at the blood pressure cuffs, maybe even have the measurement of your arm when you go in, or sometimes the pharmacist can help you with this too. At home, when you're ready to get the most accurate measurement, you really should rest for a few minutes prior to getting that number. You also want to be mindful of no smoking, caffeine, or exercise about 30 minutes before taking a measurement. I think the most accurate way to get it is being in a supported chair with your feet flat on the floor. Make sure your legs are not crossed, and make sure that your arm is about heart level. So often this translates to sitting at your kitchen table in a nice supported chair and having that arm out when you do your blood pressure. A lot of the cuffs have instructions, be sure to follow them. A lot of them they'll tell you where to line up the artery, which is usually in the middle of the arm, and make sure that it's just above the crease of the elbow so it doesn't get caught in the crease. American Heart Association suggests that high blood pressure is when the top number is 130 or above and the bottom number is 80 or above. It's normal to vary throughout the day, and it's normal to vary a little bit between arms, but if it's more than 10 between arms, you really should let your provider know. If you get numbers closer to 180 over 120, this really is a medical emergency. You really should contact your provider immediately and or even go to the emergency room for treatment, especially if you have symptoms of this hypertensive urgency, which can be blurred vision, chest pain, nausea, vomiting, or a headache. As always, share your results with your provider. Be proactive in your health. Bring that cuff to your appointment so we can measure and make sure that it's as accurate as our measurements. And word of caution as we close out, please do not regulate any of your blood pressure medications. A lot of times we prescribe these for other reasons. Sometimes it can help your heart pump more efficiently. Sometimes they have a diuretic that helps with fluid. And sometimes they have help with heart rate. So be sure to talk to your provider and don't adjust anything without their guidance. Thanks for joining us for this pocket program. I hope that was helpful. Thank you.